So today we're going to talk about the use of the MLS Class 4 laser in oral conditions in small animals. So that's it there. Hopefully you're all getting using it in practice at the moment. So we're going to talk about the general place for laser in general practice and why we use it. I'll summarise the current research on orofacial pain and inflammation. Most of this is done in humans. And then we'll go through some laser protocols for the most common use of laser in small animal practice, so post-dental extractions and periodontal disease. And if my dog's behaving, we'll use the laser for a practical demonstration and some tips on when you're using the laser on your animals, both when they're asleep and awake. And then I've got some information on feline gingivostomatitis, and there's a recent published study that has been done using the MLS laser. So I'll go into a little bit more detail about that, and then there's a little bit on treating potentially malignant tissue as well, which we'll discuss there. So photobiomodulation or low-level light therapy, it's known by all these acronyms. So we're going to be using the MLS Class 4 laser today. It's a painless, non-invasive, non-toxic, easily delivered in practice, in first opinion practice. It increases and accelerates healing. It helps with, most importantly for post-dental issues, analgesia, decreases inflammation and any side effects of its use. It increases microcirculation. And the way it does that is photoexcitation of the cytochrome C complex. This reverses inhibition of nitric oxide, activates the respiratory chain. So there's increased ATP production within the cell, and that increases reactive oxygen species as well. So that's how the main effect. But it also improves and increases the speed of wound healing. There's lots of different studies that shown there's various ways it does this. Pro-collagen synthesis, fibroblast activation, activating mast cells, macrophages. So lots of different ways it can affect things, as well as improving the microcirculation and getting rid of the toxic metabolites that are present. It also improves synthesis of serotonin and endorphins, reduces COX-2, mRNA expression, and reduces inflammatory cytokines. It also acts to vasodilate, so with smooth muscle relaxation, and helps endogenous antioxidant pathways as well. So in terms of oral conditions, where are we with that? Why are we suggesting using it within the mouth in cats and dogs? And the most pertinent really research that's been done is in the use of laser in treating oromucositis, which is a complication in people of radiation and chemotherapy treatments. So that's a study there that summarises what has been used, and there's another one there in terms of post-head and neck cancer, the use of low-level light therapy to help with oromucositis, which is very similar to some of the feline stomatitis lesions that we tend to get. Inflammation in the mouth, it can be primary or secondary to periodontal disease. It often affects many different tissues, the gingiva, the periodontal ligament. So laser is well recognised, and this is a human summary of how it can treat inflammation within the mouth. There's also a variety of studies that have shown really good effects using laser to decrease orofacial pain caused by a variety of different issues. So tooth hypersensitivity, post-orthodontic work, temporal joint, mandibular joint disorders, myalgia and neuralgia as well. There's lots of studies on nerve issues helped with laser. So I'll just move this out of the way as well, so that you can see that up there. So in oral conditions, obviously we're used to dealing with quite advanced periodontal disease in animals and in dogs, and there are numerous studies in people to show that the treatment of chronic periodontal disease, in addition to the regular scaling and cleaning, that laser can help control and reduce the level of bacterial infection that is part of this disease. It's also been shown to reduce the periodontal plaque associated inflammation, and there's evidence that it does reduce biofilms that are often an issue within the mouth. So there's a study there that's worth looking up if you're interested in that sort of area. Viral causes can be a big issue, particularly in cats. And in humans, there is a study that shows that herpes-associated infections, which tend to cause nasty, painful, ulcerative lesions, are reduced. So obviously there isn't currently evidence in cats. These studies haven't been done. But certainly the closest we've got in humans, they've shown that it does reduce the antiviral effects as well. So in terms of using laser in your patients, particularly around the head, we do need to be thinking about not only protection for ourselves around the eye, but also we want to be protecting our patients. So you can either use goggles that are available commercially for dogs, and they come in a variety of sizes for cats as well, or you can use a hand towel across the eyes to protect the eyes from any scatter, any beam reflection from leads and collars and from the table, or anything else. Contraindicated in any form of neoplasia, hormonal tissue in pregnancy. I'll go into a bit more detail about that if we are worried about a malignancy in the mouth later on. So in terms of the benefits of class 4 laser, there's pulsed emissions that emit both 8 or 8 nanometer wavelengths and 905 nanometer wavelengths. And these are pulsed, so they won't cause any thermal damage, even if we're using that directly over the skin within the mouth. And because we can use these 2 different wavelengths, we can reduce the time. So sometimes post dental treatment can literally be 30 seconds or a minute, and the treatment is completed. You tend to get analgesia from the first application. Reduction of inflammation and edema can take a little bit longer. You also get stimulation to help with healing, wound healing, collagen synthesis. You tend to be, therefore, which is all important these days, less reliant on medications, particularly reduction in antibiotics and anything else there might be side effects for. So when we're using laser with a standard treatment, we can use either the standard head, which is just here, or we can use the intraoral head that you may have seen, but actually not had a lot of uses. So this one, that would actually go onto the end of the machine, and it would be much more precise. So particularly when we're dealing with issues within the mouth, we can be much more precise, and there's specific settings on the machine to use that other head as well. We can do it, and I normally do it when the animal's still asleep, in contact with the skin and the gum, or I will sometimes hover over the skin if they're certainly a few millimeters away, to prevent any contamination of the head. I'll tend to use, depending on the size of the dog and the cat, 4 to 6 points, and it can be up to 2 joules per centimetre squared or 4 joules per centimetre squared, and this is for post-dental treatment, so post-tooth extraction, and I'll use it on the wound setting. You can sometimes then use a second treatment, 3 to 5 days later. Sometimes I'll do this actually hovering over the skin rather than in the mouth itself, and I'll tend to use scan mode because then you can treat both sides of the jaw, upper and lower, a little bit easier. But you can certainly, it takes a little bit longer, but you can certainly do it in point mode as well. There is a study there that shows that in people they found the effectiveness of using laser immediately post-operatively. We do have to wait for hemostasis. And once that's happened, we can then confidently use the laser, and it will help reduce the complications of post-operative inflammation. And that's been found to be much more effective rather than waiting for those complications to happen that then need treating. With periodontal disease, we can use very low levels of laser to have a really good effect. next, and I'll go into more detail about that later. So we'll use as little as 0.16 joules per centimetre squared, and this is because you're treating it right over the area involved, over the gum. We'll usually do that every 2 to 3 days for a week or so, and then go down to maintenance treatment maybe every fortnight, and then maintenance every 3 to 4 weeks. You can use scan mode through the skin if you can't open the mouth if it's too painful. So I'll just close this down now, and I'll show you the machine that I have set up here. So these are the settings that when you turn on the machine, this is the screen that you get. And then we'll go on to companion animal. So initially you'll go on to the wound setting. You've got a little just down here. And you'll see you'll have about 2 joules per centimetre squared. You can choose how big you want to make this. So if it's quite just 1 tooth removed within the mouth, you can probably go down to 2 or 3 points, depending on how big that tooth is. You'll then press start. And then you can see that when we press start on the laser head, so you can see I've got the laser head going there. You may not be able to see because the red light doesn't come out very well. And the infrared is obviously invisible to the naked eye. So we'll stop that. And then when we go on to gingivitis stomatitis, you can see the levels we're getting. It's set for a much lower intensity than when you're treating wounds and when you're treating skin conditions, because you need the power, the amount of joules a lot lower. You can, if you find, you can increase this if you feel you need a little bit of a higher level. You can increase it up to 50 or 100%, or even have one of these. You can see you then get a lot higher levels of joules if you have a continuous pulse wave rather than frequent. But it will tend to be 6 points that you're treating within the mouth. So if we start that off, and then I will show you with Merlin how it needs to behave. So this is Merlin here. Normally what I would do is obviously then press the button to start delivering laser. I don't have any goggles here today. So with Merlin, I'm just going to cover his eyes like that. And you can either start with treatment outside of the mouth like this, back and forth, either so you could do 2 points on the top jaw on each side and then 1 point lower down, or you tend to have to use a higher level, so go up to 50% if you're doing it through the skin. If you're going directly onto the gum, then you can do that directly over a gum. Often, once they know it's not going to hurt, you press the button to start delivering laser, and then if they move or the cover comes off the eye, you can just press that again and stop the laser straight away. So you can see the laser working. It won't do any harm even though he hasn't got inflammation. Right there over the gum. And that would be each point you'd be treating on that side and lower down. So that's, anyone got any questions on that?
How soon would you start to see a reduction in gingivitis? Would you, and what would the visible signs be?
It's whether you're also doing treatment in the mouth as well, but usually you will see a difference in pain very, very quickly. After the first treatment, you'll see a reduction in pain. They'll be much less painful. With the inflammation and the redness that you tend to see and the inflammation along the gum line, it can take a little bit longer, so 2 or 3 treatments with periodontal disease. But usually I find that I use the the laser immediately after extractions, and then at post-op check I will sometimes use it again, but sometimes I won't, because I won't need to, because the dog is very comfortable, and there's no need to use laser a second time. With periodontal disease, you tend to, particularly in cats, you do tend to have to use it at least twice a week for the first week, and then you'll use and then every week. I've still had really good results with once a week treatment, because often with it's more difficult, well, particularly at the moment, getting cat owners into the practice. These days, I would usually use the laser with the owner holding the pet, and they'll see exactly what's going on. Because we can't do that so easily now, it's actually very straightforward, because you can just, the animal can come into the clinic, and you've got a member of staff then holding the animal for you. Or sometimes you don't even need that, you can do it just yourself, without needing to use another member of staff.
And going back to the point about sort of the pain side of it, if you have a owner bring a patient in who they're off their food, you're going to probably do x-rays anyway in a practice, but if they can't afford to have x-rays,
we'll go on to feline gingivostomatitis in a second, because it can be a really painful condition. Even to examine the mouth, they can be so painful to open the mouth, especially if they've got inflammation at the back of the mouth. You might have to sedate them to examine them, in which case you can then deliver the laser while they're asleep. I've had really good results with treating lots of dogs and cats without sedating them, but just because it is such a painful condition. And then you can treat them while they're asleep, and then you'll find that usually they're then eating better the next time you see them.
Good sign for
if you just rely on sort of medications, it can take a good couple of weeks to get on control of that pain, where they're actually eating a little bit better. They tend to be really hungry and want to go to the food, but as soon as they try and swallow, that's when it must get it be really sore. So you can obviously treat the back of the mouth directly when you're sedated. You do have to be careful that you're not going too far down. That's what I wanted to point out when I had Merlin on the table. But when you're actually using the laser, try and angle it sort of from this direction forward, rather than coming from this angle, because then if they move, you're going to be, just move that camera a little bit there. If you're coming from this angle, you'll be then up into the eye very easily. So you want to sort of come from forward to, caudal to cranial. And then again, if you're treating a cat right at the back of the mouth, you want to make sure that you're not then going down and onto the thyroid or anything like that, sort of from that angle. So just being aware of where the scatter and things from the laser could be. That would be my advice on that.
And we do offer the doggles. If anyone is interested in having them, they can just let us know, and we can put a quotation together for a pack of doggles.
So we'll just go back to where we were here, and then it's how am I doing for time? Not too bad. So we've probably not got a little bit longer than just discussing gingivostomatitis. So they can be in cats particularly, but there can be conditions in dogs that they can get these really angry, painful inflammation of the gum, which even when you've cleaned the teeth and think you've done a good job with removing all affected teeth, it can really come back and be quite a struggle to manage. So typical clinical signs, obviously we've got smell, halitosis coming from the mouth, salivation, pouring at the mouth, poor appetite. Often they've got a very fragile gums that bleed easily. They can be extremely painful when you open the mouth, so much so that they'll try and bite immediately. There can be weight loss and unkempt coats, lots of things that sort of older cats can get in any case, but swollen submandibular lymph nodes and tooth lesions as well. They've thought that there is a link with Kalichi virus being a carrier, or an overreaction to antigens within the dental plaque. So it is really important to do a full history and taking into account all the clinical signs of diagnosis, as well as I would advise a blood profile, urinalysis, because a lot of these signs that we're seeing are not specific, particularly just ruling out chronic renal failure. Viral isolation, if the owners can afford this, it would be important to know whether there is, they are FIV carriers as well. As we were saying, sedation is often important, and sometimes it can be really difficult to distinguish whether it is an inflammatory lesion or whether there is a neoplastic lesion there in the mouth. So I've often just done if it sedated the cat initially, maybe done an initial, have them in, do a scale and polish, dental x-rays if you can, biopsy the lesions there. There's no harm in using laser on inflammatory areas of the mouth, even if you're not treating any areas initially that look like malignancies. Then you've got, in terms of treatment, the mainstay is total tooth extraction, or at least partial tooth extraction. So often people will leave the canines in situ. But even then, up to 60% of cats can be cured with this, but there's still a proportion that even when you've removed all the teeth, they still need further medical management. And there's lots of different ways, and laser isn't in replacement of all these treatments, but it can certainly help reduce your reliance on intermittently having to give antibiotics. So there's some details there on a lot of the antibiotics that we'll use and that have been used. We'll use sometimes called steroids. Sometimes I've found non-steroidals long-term to be very helpful, and haven't had to use cyclosporin or chlorambucil. That's certainly something that sometimes needs to be considered. I have used interferon in the past, but I think the cost and it can be having to use it, you know, 2 or 3 times a week. And you can't even use it just on its own. Certainly if you know that there is a viral component that is a big part of it, it can be helpful. Surgical CO2 laser is sometimes used to ablate the tissues, and oral buprenorphine sometimes. But I found when you're using laser, it tends to really help with the pain. So there's been a recent study to compare, and unfortunately just a small number of cats were used, and there was they had diagnosed with stomatitis, they had complete radiographic assessment of the oral cavity plus biopsy both before and after the laser treatment, and that was looked at with histology and immunofluorescence. There was exclusion if there was any systemic disease or any other treatment, including antibiotics, anything else in the last 20 days. And all the teeth were extracted. So they looked at 2 different protocols, and I can go through that again. You can see that's the settings that tend to be used in acute gingivitis or chronic gingivitis. So they looked at those 2 settings, and 6 points were irradiated each setting. That was twice a week for 5 weeks, so 10 treatments altogether. And surprisingly, the actual lower group that had the lower level of laser actually improved significantly more. They were quicker to improve. There was improvement in the pathology features, decrease in T lymphocytes. And so even though you think, oh, more laser, it must be good laser, sometimes actually being controlled and specific about how much laser you're using, when you're using it repeatedly, that can actually help, because the thought is that the higher level of laser can promote, be pro-inflammatory rather than reducing it. So if I show you on here, this is the settings that you will use within the mouth. So it'll be 6 points, 3 on each side, and this is the acute gingivitis setting. And you could do that directly over the skin, over the gum. And you do that 2 to 3 times a week. So it wouldn't be chronic inflammation setting, it would be gingivostomatitis acute setting here. And that's what you look at. And So it's shown that if I just go back here, that there was significant improvement in clinical signs. You were asking earlier, John, how soon it can make a difference. There was significant improvement in dysphagia immediately in the pain, but in dysphagia, food intake, in yawning and licking after 5 treatments. So that's after 2.5 weeks. And in follow-up, both groups improved significantly, but there was greater and faster improvement when you're using the slightly lower levels of laser in the mouth, because you're so close to the gum that you need a lot lower level than when you're treating skin disease and ears. Just a quick note on malignant growth then. So we can't recommend using laser on any malignant tissue. The reason for this, there's been studies that show increased proliferation in human leukemic cells and oral squamous cell carcinoma cells following laser treatment. But that is contradictory, because in other studies, you've got reduced increase in breast adenocarcinoma cells, and there's also selective cytotoxic effects in human oral cancer cells. They've also shown, when they were looking at treating oral mucositis in cancer patients, they did show a reduced osteoclastic potential of squamous cell carcinoma in human lingual cells when they had a pre-treatment of laser. So it's, in terms of palliative care, they've also found that it will reduce pain and inflammation. So if the patient, there's no way they can have resective surgery of a malignancy, there are anecdotal reports to say, so if there's no way you can do a biopsy, or the fine needle aspirate results came back inconclusive, if it's for palliative treatment, when there's no opportunity to remove the malignancy if it's there, then laser could be considered to help manage these patients. It's also been shown that laser is safe to use at a site distant to any malignancy. So if there's a dog that has had a mast cell in the past, there's no issue with being able to use laser in the mouth.
That's a very good point.
There's some more details there. Okay.
Excellent.
That's everything really, unless there's any more questions.
Okay, so if anyone wants to unmute their mic, or me to unmute them and ask Caroline any questions, please feel free. We will get the slides over, and as I said earlier, we can get you can re-watch this video and share that with anyone you want to via our website. So please feel free to do so. It's just making sure. Has anyone got any questions?
I've got a question. I don't know if you can hear me.
Yeah, we've got you.
So I just had a couple. My first one was, when you're, I've got a cat that has like severe gingivostomatitis, really, really bad, has been diagnosed positive with Kalichi virus. So I think he's 4 years old. He's not very well managed with the Metacam and things like that. Like, he'll go through good phases and then he'll like have bad phases. We discussed doing a dental surgery, like removing most of his teeth, but the owner can't afford it. So obviously this sounds like potentially a good alternative. In terms of, would you keep them on like medical management as well as the laser, or would you completely get rid of anything else?
Obviously, I meant to mention that sometimes the surgical treatment just isn't an option for some owners. So yeah. It can be used in conjunction. It may well be that when you start using the laser, that you'll be able to reduce the amount of the Metacam that the cat is having. Certainly that's what we find when we're treating animals with osteoarthritis. They tend to reduce the amount of pain relief they're on. So I wouldn't take it off initially. There's no contraindication to using any medication with laser treatments. So I would use them both, continue with what you've been doing that has been reasonably, reasonably effective at times. But then certainly when there's a flare up, there's even been a lot of the time I would suggest treating the cat every other day or even every day if they're happy to come in. The treatment itself is, a minute, up to a minute in terms of treatment.
He's actually a really cooperative cat, so despite how sore it looks, he lets you open the mouth, even touch the gums, which must be incredibly painful. So he's a really good candidate for laser. So that I definitely think we should start that with him. I just had another question. I don't know if it's a bit far-fetched, but obviously with things like mucoceles or any salivary gland effects or like hypertrophy or anything like that with like laser treatment in that area, because obviously if it's sort of causing cell...
in general it should reduce the inflammation present going on. If there is anything going on with mucoceles and things, it might obviously surgery sometimes to debulk these areas is important, but if that can't be done, or certainly post-operatively, that you could use laser on those areas. There's no studies to show whether it does or doesn't help.
And it wouldn't cause, and laser on a mouth just for the gum side of things wouldn't affect the salivary glands if they were just normal.
No, it shouldn't do. No, not salivary glands. It's more hormonal glands where you've got, if you're treating over the, say the testes or something, that the thyroid obviously in particular, that increase blood flow and therefore cause, higher levels of hormonal release than usual. Something I will just mention about cleaning. Obviously, a lot of the time you can use the laser at a distance, and it will still be effective, particularly in the gum when there's nothing coming in between the treatment, the area you want to treat. You don't even have to worry about the hair, obviously, coming in the way of it. You can clean the head. This one you can sterilise, and then this you can clean with your standard. Don't use any alcohol-based cleaners, but you can use Trigene and water-based cleaners. That's safe to use. Or you can even cover the head with a sterile glove, and it will still, the infrared laser will still penetrate through that. Particularly, might be worth just, if you're using it, if you've got, more than one animal that you're treating in a day, it's much easier then to do that. Clean it, obviously. We're all cleaning to a much higher degree these days, but it's then easier to use, certainly sterile, that you can then throw away.
Yeah.
Just to help with any contamination.
Good tip. Any other questions? No. I think you've covered it really well, Caroline.
Good.